When most people hear that colon cancer has spread to the liver, the natural assumption is this: the colon is the main tumor, so that must be operated on first. But here's the surprising truth. In many patients, we sometimes do the exact opposite. We treat the liver before touching the colon. Why should doctors make such a counterintuitive choice? That's what we are going to unpack in detail today. Hi, I'm Dr. Sanket Mehta, surgical oncologist from SSO Cancer Centre. Welcome to our channel where we explain complex cancer topics in a way that patients and families can truly understand. In today's video, we'll be covering a very important subject: why liver surgery sometimes comes before colon surgery in patients with liver metastases. Here is what we'll explore: how colon cancer spreads to the liver, why the liver often decides the survival, the situation where liver first surgery makes sense, the situation where colon first surgery is still essential, the role of chemotherapy in sequencing these options, how the doctor decides what is the safest and the most effective plan for each patient. By the end of this video, you will have a complete picture of how we make these decisions, and you won't need to search elsewhere for answers. Let's start with the basics. Colon cancer is one of the most common cancers worldwide, and one of the unique things about colon cancer is its relationship with the liver. The blood from the colon drains into the portal vein, which goes directly to the liver. That's why the commonest site of spread of colon cancer is to the liver and the peritoneum. In fact, about 25% of the patients with colon cancer are found to already have liver metastases at the time of diagnosis, and another 20% may develop them later in their journey. So when we talk about colon cancer with liver metastasis, this is not rare. In fact, it's a very common real-world scenario. Now let's address the key question: why is the liver so important in this story? The liver is often the organ that determines survival. Here's why. The colon tumor, while serious, usually grows locally and causes problems like bleeding and blockage. These are difficult but manageable. But liver metastasis can grow silently and aggressively. If they spread too much, surgery is no longer possible. And once liver disease becomes inoperable, survival outcomes drop significantly. So from a survival perspective, the liver is the driving factor. That's why many treatment strategies prioritize controlling liver disease as the first step. This brings us to the colon itself. You might be thinking, but isn't the colon tumor the original cancer? Isn't that more important? Here's the nuance. Unless the colon tumor is causing an emergency such as obstruction where the intestine is blocked, severe bleeding, or perforation where the wall of the colon bursts, the colon tumor itself can be usually stabilized with chemotherapy. Chemotherapy often shrinks it or keeps it under control for weeks and months together. That window allows us to focus first on the liver, which may not give us as much time. Chemotherapy is the crucial part of modern colon cancer treatment. When colon cancer has spread to the liver, most patients receive chemotherapy before surgery. This helps in two ways. One, it shrinks the tumor in both the colon and the liver, making the surgery easier. It shows us how aggressive the disease is. If the cancer doesn't respond to chemotherapy, surgery may not be of much help either. After chemotherapy, if the liver disease looks operable, we often go in there first. Then, once the patient has recovered from the liver surgery, we come back to the colon. This is a very common question. If both the tumors are there, why not remove them both in one operation? The answer is, sometimes we do. In selected patients with small, easily resectable liver lesions and a manageable colon tumor, we can remove both in the same setting without any additional risk. But in many patients, the liver surgery is a major one, sometimes involving removal of more than 50% of the liver. Combining that with colon resection increases the risk of infection, higher risk of leak from the colon joint, slower overall recovery, higher risk of liver failure, and that is why, for safety, we often stage the operations, one after the other instead of combining them. So when do we go for liver first? When the liver disease is extensive but operable and delaying might make it inoperable, when the colon tumor is not causing any immediate symptoms, when chemotherapy has controlled the colon tumor but the liver needs urgent clearance, and when combined surgery would be too risky. In all these cases, treating the liver first ensures that we secure the step that truly drives survival. But there are also situations where colon must be treated first. If the colon tumor is causing blockage, that is, the patient can't eat or pass motions, that's an emergency. If it's bleeding heavily, it has to be stopped. If it is perforated, surgery cannot wait because that leads to life-threatening infection. In all these cases, the colon comes first, followed by the liver once the patient has recovered. Here's the key message: the sequence is not fixed. It's not always colon first, and it's not always liver first. It's about strategy. Doctors consider the biology of the disease, the patient's symptoms, the response to chemotherapy, and the risk of each of these approaches. Then we choose the sequence that maximizes survival outcomes and minimizes the risk of complications. And here is an important principle to remember. If the primary colon tumor is not symptomatic, it is almost almost always better to treat the liver first. However, if the primary tumor is symptomatic, causing obstruction, bleeding, or perforation, then we must first address that emergency, stabilize the patient with chemotherapy, and then return to the liver focusing strategy. So if you or someone you love has colon cancer with liver metastasis and the doctors are recommending liver surgery before colon surgery, don't be alarmed. It doesn't mean that we are ignoring the colon. It means that we are carefully planning the treatment in order that science gives the best chance at long-term survival. I'm Dr. Sanket Mehta from SSO Cancer Centre. Thank you for watching. If you found this video helpful, please share it with someone who needs clarity on this subject. Awareness and understanding can make the treatment journey far less overwhelming.